So taking you now to India, we talked about this earlier, where the coronavirus is spiraling out of control. The country has reported more than 300,000 new cases for the 6th day in a row. Over 2,700 people died as a result of the virus in the last 24 hours alone. Now other nations are pledging their support, so Lucy Craft reports.
Scenes of tragedy play out daily at the gates of Indian hospitals with the desperately ill and their families left to fend for themselves. This man said, "I took my relative to 2 hospitals, but they refused to admit him. We are standing here with a patient in the middle of the road without oxygen, without any hope." With even hospitals struggling to source vital supplies, finding a coveted hospital bed no longer guarantees treatment. This man said, "My mother is admitted here, and I don't think they are taking good care of her. The oxygen cylinders need to be filled every half hour, but they are not even checking them." The vertical spike in cases and deaths has unnerved even those long accustomed to handling last rites. There are reports of cremation workers running out of wood for funerals. Cremations are being conducted non-stop, even on roadsides. "I've never seen such a terrifying situation. I can't believe we're in the capital of India. People are dying like animals," this cremation worker said. Even with the U.S., the U.K., and other countries starting to ship supplies, and India repurposing sports stadiums, passenger trains, and even religious spaces for temporary treatment centers, India is bracing for cases and fatalities to continue spiraling over the next few weeks. COVID safety protocols like social distancing have waned in recent months. Large crowds have gathered at political rallies and religious ceremonies. India's humanitarian crisis is a reminder, World Health Organization officials said, that even as some countries venture a return to normalcy, COVID remains a global menace, and nations that open up too soon risk becoming the next India.
That was Lucy Craft reporting from Tokyo. Now I want to bring in Emily Schmall, a South Asia correspondent at the New York Times, to talk more about the latest out of India. So Emily, look, you know, every country has dealt with sort of a second and in some cases a third surge of this virus. We know that's how it works. There's going to be a cycle. And so in many ways, this is another surge in India, but it's way more than a surge. It's worse than it was the first time around. Why are we seeing this tremendous spike now?
Well, experts don't know for sure, but they have some theories. One is that the virus the first time around mostly resulted in mild cases. The death count wasn't very high compared to other countries that had been also really hard hit. And it seems that there's a new variant circulating. It's considered to have a double variation, or a double mutation rather, that is far deadlier and that's infecting far more people. The first time around, younger people were largely spared from the disease, but this time hospitals are reporting that many young people are also showing up looking for beds and support.
So India is finally getting the attention of other countries. What kind of aid are other countries pledging, and is the Indian government open to it?
Yeah, I think the Indian government is certainly receptive to aid at this point. I think there's some general recognition that it needs this to be able to stop this catastrophe. But the problem is that, for instance, with oxygen, India has potentially a sufficient amount of medical oxygen, but it doesn't have the transportation and the logistics it needs to get this oxygen to hospitals on time. So what we're seeing is tragically a lot of hospitals sending out these SOS messages on Twitter and other social media saying that they're 45 minutes away from depleting their oxygen supplies and asking for help. And then these oxygen tanks racing to get there and sometimes arriving literally 10 or 15 minutes too late and dozens of people dying. So while the US, the UK, France, and other countries are pledging and in some cases have already delivered some supplies of oxygen and ventilators and other medical equipment, it still remains to be seen whether this government can coordinate a system that will get oxygen to where it's needed in time.
So the vaccine rollout has not been the best either in India, which is sort of ironic because India has the capability of producing a lot of vaccines. They have vaccine production sites there. In fact, there are other countries that rely on India for the AstraZeneca vaccine because millions of doses are manufactured there. So how could the coronavirus crisis in India then potentially cause a ripple effect when it comes to fighting the pandemic beyond the borders of India, globally?
Yeah, well, let me just put this into a little bit of context. Back in January, when India began its own vaccination program, it started, like a lot of other countries, restricted to healthcare and frontline workers. And at the same time, the government of Prime Minister Narendra Modi actually gave away a good number of vaccine doses and sold vaccine doses. About 66 million have left the country since then. And so the attitude seemed to be then that India was in decent shape and could afford to give away these vaccines to needier countries. But suddenly in late March, Mr. Modi clamped down on exports of vaccine. And since then, India has been absorbing pretty much all of the 2.4 million AstraZeneca vaccines doses that are made here on a daily basis. And that's still turning out not to be enough. This is a country of nearly 1.4 billion people. The AstraZeneca vaccine requires 2 doses. There's an indigenous vaccine that's also being distributed here. But for whatever reason, the turnout has been relatively small. Only about 50% of healthcare workers came out when it was their turn. And so now on May 1st, the government says anybody 18 or over can get a vaccine, but it's really not clear whether there's sufficient supplies. And then again, there's a question of organization, whether there's going to be enough organization to ensure that anybody who really does want to get a vaccine can get one. And then lastly, how this will affect the rest of the world is that the AstraZeneca vaccine is destined to a lot of foreign countries, and it's not necessarily going to reach them until India can get control of the situation here.
Yeah, we're going to actually pick up that conversation sort of in our next segment, because I know that AstraZeneca was sort of the backbone of the European Union's vaccine rollout sort of plan as well. So we're going to talk about that. Emily Schmall, thanks for letting us know what's happening in India, though.
Thank you.